Hello, everyone. Today I have Dr. Levi Harrison, who is a orthopedic hand surgeon and a lecturer and the esports doctor. How you doing, Dr.
I'm
Harrison?
doing great. Pleasure to talk to you, Lon. Thanks for having me on your podcast.
Yeah, of course. Shall we get started?
Absolutely. Let's roll.
All right. So what really inspired you to go into medicine?
Well, I was inspired to start a career in medicine because of my mother. My mother was a nurse's aide, and I saw what she did, and I also saw the amount of love, care, compassion, and empathy that she had. That really made me think, wow, how could someone be so kind to people who she doesn't really know and they don't know her? But she really embodies this spirit of compassion and empathy and giving. And from there, I thought, okay, that's what I want to do. I want to live a life of really um, unapologetic service. And I think that's what medicine is. Medicine is about giving back and helping people and understanding that we're here to help and love and be kind to people, no matter their race, their creed, their sex, their sexuality, their gender identity, their religion. All that is inconsequential. What's important is that we treat people the way we want to be treated. And I saw my mother do that. So she was really one of the key inspirations in my life. Yeah,
Yeah, it's the golden rule.
I
Treat
think
others.
so.
Yeah. And what made you specifically want to go into hand surgery?
Well, that's a very interesting question. So I always wanted to be a surgeon. But there's a real interesting event that happened when I was a kid. I was maybe, I think, 7 or 8 years old. I remember talking to my father and my great grandfather. Both have passed now, actually. But while talking to them, I remember telling my great grandfather, he said, "Well, what do you?" It was at my birthday party, and he said, "Well, what are you gonna be, Levi, when you grow up?" And I turned to him and I said, "I want to be a doctor." And my father chimed in and said, "What kind of doctor?" And I said, "I want to be a surgeon." And my great grandmother said, "What kind of surgeon? You can't even spell surgeon." And I turned to him and I put both of my hands up and I said, "I'm going to be a hand surgeon." And that it's happened, which is pretty interesting.
Yeah, I mean, you put that in the universe and you just kind of you grabbed it.
You're exactly right. You manifest what you put out. You put out the light, you get the light. And that was my thoughts then as a kid, and now many years later it's manifested reality. So I just feel grateful, and I'm happy to be in a place where I am. It's a good place.
Yeah. Were there any other specialties you considered? Like even you were a kid, you wanted to be a hand surgeon?
Well, yeah, even as a kid it was always hand surgery, but then when I started medicine, when I started doing my classes at the university, I really loved psychiatry a lot. And I also loved obstetrics and gynecology a lot. So I really initially thought about doing this combined program of psychiatry and orthopedics. And I had a lot of roadblocks when I spoke to people about doing that. They just thought it would be better to really choose one. And in hindsight, I wish I had followed my initial intention, which was to do both of them. Um, but I don't have any regrets about it because I love orthopedics and I love hand surgery, of course. I love hand, wrist, elbow, shoulder also, but I really love hand, wrist, and elbow. Um, so I have no regrets about it. But I do, I think, look back and think, wow, would my life be different had I made different choices? Because with everything, whatever you choose to do, there are always consequences. Some good, some bad, and some okay. And I think so far, all my choices, by the grace of God, have been pretty good.
Yeah. If hypothetically you did go down that double path,
Yes,
what would you be doing with both of those certifications?
I would definitely be doing sports psychiatry. I'd definitely be working with athletes. I would definitely be working with the pediatric population to guide them to being safe athletes. I would definitely be involved with male and female and non-binary, no matter what their gender identity is, I'd be involved in sports. That's for sure. As an athlete and as someone who really appreciates the discipline that it takes to be an athlete, as well as the strength and power and focus that's required. I would definitely be working with athletes, and that's for sure. Yeah, that's for sure.
What kind
The other
of
thing, the other thing I'll share with you too, Elon. The other thing I'll share with you is that I had another really phenomenal teacher at the university. His name was Dr. Jeffrey Kanji, who's a phenomenal clinician, phenomenal human being, uh, incredible teacher, uh, just a real lauded humanitarian, a great human being. He really, really influenced me also to consider family practice with a subspecialty in sports medicine, which I really considered. But then when I did my uh, orthopedic rotation, I loved it so much. I didn't necessarily like. One thing I will say about hand surgery, when I was doing a rotation, the thing that I would say I didn't like is there were some people that when you see this when you're in medical school that you rotate with, they're on a certain service, they don't like it, and then they complain about it. For me, if you don't like something, complain to yourself. I don't really want to hear it. I mean, if you're not happy, it's okay. Why don't you just take that with you? But you don't have to share it with me. I just want to stay in the light. Um, so that was always interesting because when I did my hand rotation, several of the people on that rotation hated hand, and they would voice that. And in my mind, I was thinking, God, I love it. I I don't see anything bad here. And so you see that when you start. I have a few questions for you also. What
yeah,
what 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 has really guided your thoughts about why you want to go into medicine?
that's a good question.
Hmm?
Me personally, I I I love like the human body is the greatest piece of machinery that has ever been either designed or evolved. It's just beautiful. And
Yes,
to be part of it and to help it run in its most optimal way is just like makes me pushes me forward. Like
absolutely, absolutely, absolutely.
it's
And I have another question for you too. Is
yeah.
what do you think you want to leave as your impact in medicine? Like where do you see yourself going when you start your career?
That's a very good question.
Mhm.
Um, hmm. What do I want my impact to be?
Yes, yes. Because the impacts
Just
usually, when I talk to people, they all often say, "Well, I want to be of service. I want to do good in the community," which are great answers. That's a great thing. Or they'll say, "I just want to make a lot of money." They'll say things like that, and none of that I don't have any type of judgment about. I just want an authentic answer. So when you look at starting your career, where do you think you'd like to be? 20 years from now?
yeah, right now, um, I really enjoy like emergency medicine. I work in the ER, I work in urgent care, and in those moments when someone is in the ER, they're very, very scared. Very rarely are they coming in calm and expecting to leave with no ailments, right, or no diagnosis.
Right.
So you are kind of this figure of trust and of um like of truth, right? You're trying to find out what's happening. So just someone that uncovers the truth. They brings like calm to the storm. I hope that was a good answer.
No, no, it's your answer. Your answer is a good answer. I'm always curious about that when I talk to medical students or residents that follow me in the office. I always ask them like, what's your hook? Why did you choose this? Why did you not go into real estate or investment banking or become an accountant or a chiropractor or massage therapist? What made you think I wanted to pick up this torch and go forward to live a life in medicine, which is a very challenging life, you know. I have another question for you. What do you think will be some of the sacrifices that you'll have to deal with when you start medical school?
That's a good question. Um, well, already, even as a pre-med, as a college student, like I was working all of Labor Day weekend. That's number one, and my family was all home, and they were all doing things, and I was in the emergency room. Um, you you have to. I think the biggest one is obviously going to be just like your time with like your non-medical friends or family, right? But even through that, you make new friends in medical school or in residency. You're you find the people who understand the struggles that you're going through right now, and they're going through it with you currently. So it's just um, it's going to be a struggle to maintain all the relationships that you have, but you just have to push through and figure it out.
Yes, yes. One thing I can share with you that someone told me when I started medical school, she said the most important thing to contend with will be balance. Really balancing your time and your energies with the people and issues that matter most to you. So one thing that I'll share that with you to, I mean, I'm sure you get a lot of other thoughts from other people, your father and family and friends, but that's one thing I'll share with you is to really try to be in that middle zone of balance. You know, you have to sacrifice a lot for medicine, of course. You already know that. You've seen it with your father, you've seen it in life. However, with great sacrifice, of course, comes this ability to prioritize which things and people and issues deserve your time. Because everybody doesn't, and everything doesn't. And it'll be really interesting you see as you continue with your career that sometimes even family and even your closest friends, you'll have to love them from a distance. And it'll be difficult, and you'll see all the people that start with you on your journey, they won't be there at the end. They won't be able to take the, oh, I can't come to the party, I can't come to the Yom Kippur celebration, I can't attend the Shiva, I can't attend the baptism, I can't attend the bar mitzvah or bar mitzvah. You won't be able to go because your priority, you will be literally married to medicine. It'll be your first, well, it'll be your second wife. Your first wife will be your spirituality or your spiritual beliefs. You know, we always say God, career, family, and medicine is really that. When you take that Hippocratic oath, it's about really prioritizing family and friends. But then sometimes, even when you prioritize them, you have to do it from a distance, and it'll be a challenge. I'm sure you do well, but just keep that in mind. Balance and moderation, and I'm sure you do great. And I also want to know as you're seeing people in the ER, besides being able to give them compassion and empathy and be a sense of security for them and some authority about wanting to help them, when you see people in the ER, what do you think is the number one priority that you should extend to them? Do you think it's compassion? Do you think it's understanding? Do you think it's wisdom? What is the one thing that you think is most important?
I think understanding is very important because a
Hmm.
lot of times I mean, the ERs, you see a lot of acute things, and because you see a
Yes.
lot of acute things, people don't have the full they haven't seen like their primary care physician or primary care provider to talk about that beforehand, so they
Yes.
are experiencing a new sensation that's never happened to them before. So you have to kind of show that this is something that can be fixed, can be managed, and there's nothing to worry about unless there is, and then we got to intervene, right?
Mhm. Yes.
But understanding is very important because once they have the understanding, their stress can go way down, and like they can appreciate the compassion that you have. Every other value is much more visible once they understand what's going on with them.
Great. Yes, and what do you think will be your greatest challenge when you start your medical career? What do you think are the things that will be the most challenging? Not necessarily difficult, but do you think it's going to be challenges being away from your family? You think it's going to be a challenge to not have your friends around as much? You think it's going to be a challenge having to go so deep academically to maintain your grades and to do well scholastically? What do you think will be some of the major challenges that you will have to overcome?
First of all, I think there's no challenge uh, great enough or there's no challenge that's impossible. Whatever obstacle I encounter, I have faith in myself that I can overcome it and move past it.
Yes.
Um, that being said, I think the relationships is huge, right? Being away from like the place you've lived your basically your whole life, or even somewhere you've dedicated 4 years to. Um, that's it's obviously hard for anyone. Um, academically, I think because I personally I feel I have like such a passion. Academics obviously is going to be difficult, but it's not going to be the greatest challenge because I love diving into just the minutia of like anatomy and physiology and pathophysiology and just all of these things. So I think the relationship aspect will probably be um, the most difficult.
Yes, yes. And what do you think is the greatest gift or skill that you have that you will offer to your patients?
I want you to answer that one too. That's a really good
Oh,
question.
well, I have an answer for that. I can tell you that.
Um, what is the greatest gift I can give to my patients?
Hmm.
Just I was interviewing my pediatrician, and he said just listening. Listening is just your undivided attention to their problem is the greatest gift they could ever have, at least in my opinion.
And you agree with him.
I do agree with him. I think he's just once you listen, they can fully give themselves to you and to your care, and you can give the best care back.
Hmm. Hmm. I think that's very, very true, and it really resonates with me. I've always thought the number one thing, which is very similar to this answer, is to simply be present. If you're present, when I say present, Alon, I really mean you are truly present, where you are looking at them eye to eye, you're listening to them, you are not looking down at your phone, you're not looking at your watch, you're not, whispering and whimpering, like, okay, are they still talking? That you really are present with the person. And again, I want to reiterate that you're present with them, no matter their race, creed, sex, sexuality, or gender, no matter how well they speak English or not, no matter how well you speak their language or not, that you are really there and fully present and fully engaged. And I think when you're present and you can bring a sense of unerring, unapologetic empathy, because people can always spot the BS. They know when someone is just there to do the job and that they don't really care about. We can always feel those people. We know when they're disingenuous and they're not honest, not authentic. We can feel that. But we can also feel when people are loving, when they're kind, when they're generous, when they're looking at us like we matter. And I think so important, we have to really appreciate our patients. And you'll see this. I hope you remember this one thing from me in this interview is to really look at people and to be present and know that they matter. They matter. They're important. When you see a man or a woman or a boy or a girl, they came from a parent, they have a mother, they have a father. So, by definition, if you don't know anything about someone, you know they have parents, and that you know that they're a human being and they should be treated with with respect and acceptance. And in your case, when you become a physician, with your dedicated expertise, which is important. I have another question for you also. What do you think is the greatest weakness that you have to overcome to be a really formidable, compassionate physician?
Yeah, before I start, I want to thank you for the future interview prep.
Oh yeah, I'm giving you that. Exactly. Exactly. You're welcome.
um, hmm. My greatest weakness
Yes.
to becoming a physician, or
Nope.
just
You think the greatest weakness that you have to overcome to be a better physician?
good question.
I got a lot of them.
Yeah. um, I mean, battling the social determinants of health is I already see it is going to be a brutal challenge.
Give
Uh,
me a deep dive on that. What do you mean by that? What does that mean specifically? That's a very broad, general statement. What do you mean by that?
yeah, I mean, if someone okay, I remember there was a patient in the ER who was a recovering opioid addict,
Yes.
um, and like he was in desperate need for um, essentially like a refill of his medication, right?
Yeah.
Um, and like we as the emergency room, we had limitations on giving him this medication. He had limitations on like the way that he came, the timeline.
Yes.
It was a whole ordeal,
Right.
and we wanted to give him the best care possible, but there were things in our way. Uh, the timing, the medical legal aspects, just
Mhm.
it, it not everything is in your control, and trying to uh, make peace with that and do
Yeah.
the best you can with that is uh, royally important. And
Mhm.
I sometimes have a problem trying to like understanding that not everything's in my control.
Yes.
So that
Yes.
is probably my greatest weakness.
I think it's great to recognize that as a weakness, because any weaknesses we have, once we recognize them and call them out, then we can strengthen them. And
Hmm.
I think it's great to hear that you have that self-awareness to know that you will have to deal with those political issues in the ER. You know, people saying, well, this is my patient, you know, my service. I don't want to do this. I want you to do that. When you feel like, well, that's not the best treatment. We should do this. But you really have to acquiesce and let other people handle their patients the way they want to handle them. And then you handle your patients with the compassion and love and curiosity and acumen that you have to elevate and optimize their health. But it will be a challenge that you're going to see that. And you're going to see it, especially now with the way healthcare is changing and where insurance companies are changing. You will definitely be very aware of that. But you'll be able to deal with it. Sometimes you have to just pick your battles. And it's always better, I always say, to say nothing unless you have something of value to say. My dad would always say, you only speak when there are three things that are going to happen. Number one, you should always ask yourself, is it true? Number two, does it have to be said? And number three, is it uplifting and elevating? If it's not one of those three, he would always say, Levi, you should be quiet. So I hope you just remember that just to be clear about choosing your battles, choosing your friends, and also be aware of your enemies. Because you have to work with both of them. That's the funny thing. People that you're going to think are just the very difficult to deal with. One thing I can share with you too about that is the people that are the angriest and the most difficult and the just really not happy people, they need the biggest hug. So
Hmm.
when they're like that, be more kind, be more loving, be more generous, be more forgiving. When they're screaming, then you should be whispering. When they're hollering, you should be speaking. uh so something to keep in mind. I hope that helps you on your journey.
Yeah, and that's comes back to understanding, right? You got to understand their situation, and you have to give them understanding. Yeah. What?
Well, one thing I'll share with you too, you do have to give them understanding. You have to give them grace, but you also have to let them know that what they're doing is not right. You can't just give them a hall pass. That doesn't work because then the behavior persists and continues, and everyone will say, "Well, we don't like them," but no one tells them why. So people can often self-correct if you let them know, "Hey, you know what you said really made that patient feel unhappy and is crying, is not happy, blah, blah, blah." Sometimes you have to tell them, and sometimes they'll say, "You know what? Yeah, I have to do better." Or they'll tell you, "It's just the way I am." And often when they say that, it means that I'm not changing for you or anyone else. I'm going to be this way until I'm buried or cremated. So when they do that, then you just have to do your best to remain kind, remain calm, and remain compassionate. Yeah.
Yeah, and that goes back also picking your battles, right? If someone is
Absolutely.
unyielding, there's you just have to let them go for their course, I guess.
Exactly right. And you're going to see that. You're going to see some of the attendings you work with. Some will be some of the most amazing, beautiful, phenomenal teachers and wonderful human beings and humanitarians and philanthropists. It's going to be some of the most phenomenal people you meet. And then you're going to meet others who are on the other side of the spectrum. And so those people, be loving, be kind, and I always say, no matter what they do, don't take it personally. I
Yeah.
want to recommend that book to you. There's a book. If you don't have it, I'll get it for you, and I'll give it to your father to give you. The book is
Mhm.
entitled "The Four Agreements." It's one of my
Mhm.
favorite
Yeah,
books.
I've heard of it.
Um, yeah, I'm going to get it for you. I'm going to give you that as a gift that you can read it. And remember, Levi Harrison gave it to you because I think it will really help you on your journey. I was going to tell you the four agreements. I don't want to tell them to you. I want you to read the book because the book has such extraordinary depth and pathos when you read it. It's a very small book, but it's full of great wisdom.
Mhm. Yeah. What was the most valuable thing that you learned in medical school or residency?
Oh, there were a few, but I'd say the most valuable one is that the thing that sustained me above all was my faith, which is believing that no matter how tough things got, that I had I had enough spiritual strength, faith, and protection that I could make it through. So for me, it was always about going to my place of spirituality and believing that no matter how dark it was, how dark and angry and difficult the people that I worked with, that if I stayed in the place of light, love, forgiveness, and grace, that I would be able to get through successfully and to do my best to remain a remain in the civility of my own humanity. That to me was really, really important. And to not become like them. The great thing about people, and you'll learn this on your journey too, and I've learned it. We learn it from our parents as well as from our friends. They teach us how to act, but they also teach us how not to act. And I think sometimes the former of the two, well, both are important because they both help to shape who we are. So I hope you remember that too. People teach you how to act, but they also teach you how not to act. So
Definitely. Yeah. And you're also you're an athlete. So
I am
I
an
know
athlete.
a lot of people, especially in medical school and going throughout their journey for no matter what they're doing, um, faith and physical activity really help with stress and coping and things like that. How has that helped you? And if so, what specific practices have you done to become a physician?
Well, the number one thing that I did is, by the grace of God, stayed in this place of understanding. I always call it FAF, which was faith and fitness principle, because I've always felt like if you can stay on the FAF path, then when things are tough spiritually, then you can work out and work it out. When things are rough on you physically, you can go to this place of spirituality. You know, there's always a place to go. You're never alone. So for me, it was always knowing that I have to work out. I have to work out every day. Nothing else compromises that. If I have a competition coming up from a fitness competition, bodybuilding fitness competition, then I have to get ready for it. The number one thing that I did was I wrote a book. I wrote a book on fitness, which to me really helped me focus on the science as well as the art of fitness, because there is an art to being fit and to having a great body and a healthy mind. You know, you really want all three. You want balance psychologically, spiritually, physically. You want that whole trifecta. um and I think that that was really one of the best things for me, is to to work out, to stay fit, to do different sports, you know, from CrossFit to gymnastics, to have keto, to Ninja Warrior training. You know, for me, after parkour, everything you do allows your body to increase its dimensionality with respect to fitness, you know, because you expand yourself. The more you do, the more fit you become. You give your body a chance to elevate and optimize itself, you know. The other thing I can share with you that I think helps a lot is intermittent fasting. I'm a real extreme intermittent faster, and I think that really helps with respect to not having a lot of food in your body, you know, kind of like living in this pseudo state of autophagy where your body is just taking out the bad stuff, basically.
I'm fasting right now, so this is
Oh, that's a good thing, man. Yeah. I recommend do it every other day. Eat once a day, every other day. I think it's a great way to do it.
yeah. I mean, there's me personally. I've tried, and it helps. It helps. Like here we go. It helps in the like the beginning stages where you feel super clear, and then
Yes.
for me, I just fall off a cliff. I just like my my brain stops working, my body stops working. It's all like it's a whole ordeal.
Really? So you
Yeah,
feel a sense of brain fog.
yeah, definitely. And I very much pride myself in being super clear, and it
Right.
just like I don't know.
Well, the good thing is that you know what works for your body. So maybe
Yeah.
only 12 hours a day works for you, you know, just fasting from breakfast until lunch, or maybe from no breakfast, no lunch, and just eating one dinner. You know, you have to just listen to your body. I'll tell you something funny. So yesterday I was with my physical therapist, who's really wonderful. Um, and we were talking, and one of the other therapists came in the room, and he said, "Oh, hey, Dr. Levi." And I said, "How you doing?" We started talking, and he said, "How you doing with your fasting?" I said, "Yeah, that's part of my life. I do it." He said, "Oh, me too." And then when he said, "Me too," she looked at me and she said, "What are you talking about?" He said, "Well, I'm fasting. I didn't eat breakfast." She said, "Yeah, but you had two lunches." when 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 she said that to him, he said, "It still doesn't matter because I had no breakfast." And I said, "Well, what did you have for lunch?" And he started telling me, and it sounded like a 5 course meal, man. I said, "Well, I said you did fast breakfast, and you know you have to meet people where they are, you know." So he said, "Are you still proud of me?" I said, "Absolutely." I said, "Some fasting is better than no fasting." But when she said he had two lunches, it was really one of the funniest things, man. I have another question for you too.
Yeah.
Um, when you start your path right now, because I'd like to have this conversation with you 5 years from now, which branch of medicine do you see yourself having the greatest contribution? You think emergency medicine? You think orthopedic surgery? You think what are your thoughts right now where you are?
See, this question has changed like
It's gonna
probably
change.
every
It's gonna
single
change.
every single month.
It's going. I just want to hear where you are today, October 12th.
Yeah, today, um, like I emergency medicine, I think is
Mhm.
very is just really amazing because you are like a jack of all trades, right? You see a bit of everything, and
Yes,
you
yes.
just you have to remember and just be able to give care on basically every single body part, which is in crazy.
Absolutely. Absolutely.
Um, surgery is very, very interesting to me. I think that just our ability to be able to take someone and physically alter them in a way that makes them better is just amazing, amazing.
Right. Right.
And in the case of, I don't know if this is so much the case with hand, but I know with general orthopedics, you are physically putting in other things also. Um,
Yes.
so, it, just quickly for my curiosity, are you using lots of implants for hand surgery, or is that not really a?
We don't. We don't. So for us, for example, I have a case coming up next week. I think it's a fusion of a finger, where I literally put in some, they're basically pins, we'll say, that will stay in to fuse a joint. And a gentleman has had a dislocation now for I think like 8 or 9 months. He didn't want to have it treated, so now he has to fuse the joint.
Hmm.
Um, but there are some injuries, for example, or some types of comorbidities, for example, rheumatoid arthritis. Sometimes they will put in implants for the joints. I'm not necessarily a fan of those, but sometimes they'll do that. I'm not a fan of that though. Yeah, I'm not a fan, but some people do it, and I don't. I think if you talk to five different physicians, you're gonna get five different answers
Hmm.
because we're all very different, like everyone is. But in my mind, I always try to do things that are minimally invasive, that will give the best thing to optimize the patient's health, to get them back to function, and to get them back to work and living the life that they were living before the injury. Because when people are injured, it's really traumatic for them. You do treat the physical, but even as an orthopedic surgeon, I'm always keenly aware of the psychological trauma that a person has had from an amputation of a finger, for example, or a severe back injury, spinal injury, or if they went from walking and now they're paraplegic and now they have clawing of their fingers from the spinal cord injury. I'm really aware that you really want to consider um, the psychological impact and then getting them that proper care to speak to a psychologist or psychiatrist and to remind them that it's okay. It's okay if you're hurting. It's okay if you're feeling this sense of, post-traumatic stress or anxiety or depression even. Um, so I'm just really aware of that. You have to treat the whole patient. I hope you remember that. You don't just simply treat the injury. If they have a wrist injury or have a headache, you want to go deeper to find out what else is going on that you can help them to be on a healthy journey of self-awareness and fitness.
Yeah, especially if someone has been like doing sports at a high level and they get injured, that is crushing because they.
Question.
Yeah.
It really is. It really is crushing. Almost 2 years ago now, I had a really bad injury, and I'm still going to rehab for it actually. And it was really severe. It was a blow to my mind that I couldn't use my body the way I've used it for so many years without any issue, and to literally be in a wheelchair for a little bit and then on a walker, a cam walker boot thing, and then a scooter. It was really, really intense. Um, but it really humbled me to remember how my patients feel when they come in on crutches or when they're in a wheelchair or on the scooter. Um, so I think, life is such a phenomenal teacher, and it really helps to expand our capacity to have great compassion for other human beings, especially when you've walked through or came out of an injury when you're on the other side and you look back, if that makes any sense.
Yeah. We, that's a big principle, at least from what I've learned in rehab, is just like write down like the stages that you go through, because we as humans are not very good at seeing like the past and where we were and where we are now. Um, you
I
know.
agree.
Sorry.
I absolutely agree with you. I absolutely agree with you. Yes, I do. That's that That's just the truth. You're absolutely right. Now, I have another question for you. What do you
Mhm.
think you want to train? Do you think you want to remain here in California? You think you want to like spread your wings and go outside of this area? What does your heart tell you where you want to stay?
Ooh, I wanna travel the country,
Mm,
see
that's a
other
good thing.
places. California is great.
Yes, it
Um,
is. Yes, it is.
home, but I like there's however many like I don't know, there's 49 other states.
You got that right. Plus Puerto Rico and a few other.
Oh,
You're absolutely right. And the U.S. Virgin Islands. So yes, yeah,
yeah.
I think it's great that you want to expand. You know, I can tell you though, in general, most parents want their kids to stay, but it's your life and it's your career. So I highly recommend that you consider doing that because it really, you know, let's say if you're at New York University or Harvard, Stanford, well, Stanford's here, but if you're at, let's say, the Mayo Clinic, for example, in Minnesota, Minneapolis, I think, you know, it gives you a chance to just be in a different place, experience a different climate also. Because one thing about California, you just definitely can't beat the weather here.
Mhm.
That's for sure. So I think it's great that you want to consider you know, you can always come back and practice here, but it's definitely good to consider going to a different place, meeting different people. You know, I came from New Orleans, Louisiana, so to go from New Orleans for the first, you know, part of my life to University of Notre Dame for the next part, and then Howard University for the next part, and then to come to California to UC Davis, and then to Orthopedic Hospital, King Drew Medical Center, USC Medical. It just, you know, it gives you this real sense of national and international travel, you know. So I hope you do that. That's a great thing.
Yeah. Can you talk a little bit more about like that timeline of you starting from undergrad to all the way through being an attending?
Oh yeah. So that was 21 years. So initially I went to University of Notre Dame and I did a BA and a BS program there. So I have a Bachelor of Arts in Romance languages, which is, you know, my power language is French, and I have a BS in electrical engineering. And I went from there to Howard University, where I have a master's in engineering, which was a concentration really in solid state physics. And then I went from my master's to medical school um, at UC Davis, where I was there, and I did my MD there. And then I did another year there afterwards. I did a year of internship there. And then I did 5 years of orthopedic residency. And then I did one extra year of fellowship training in hand, wrist, elbow. So total of 21 years. I'll tell you a real funny joke though. My mother used to always say of all of my, you know, degrees, she always said the most important one for her was the award I got for perfect attendance from kindergarten to 12th grade. And to me, it's like, and I used to ask her, so why was that so important? She said, well, because not only did you get perfect attendance from kindergarten to 12th grade, she said, my name should be on that award because I took you to school for the
Mm,
first 10 years, you know? So, so it shows you different priorities, you know.
yeah.
Not the BA, not the BS. Not one thing I forgot to say too is then after at UC at Notre Dame, I also lived in France for a little over a year. I did a program there, living abroad. So that's how I got up to 21 years in school.
Yeah. And why did you pursue a BS in engineering and a master's in engineering if you knew the plan was medical school?
Oh, because I always thought that if I can think like an engineer, I could be a better physician. That was my thoughts. That if I could understand the basics of how the universe was formed, how what physics really is, what biology really is, understanding the basis of calculus and mathematics, differential equations, my thoughts, if I can understand those things, then the goal would be to apply them to medicine to be a really formidable, well-skilled physician, and to be able to invent things. I have quite a few patents. I have a device that I invented called the triangle, which is really helpful for people with hand injuries if they want to strengthen their hands, or for athletes. So for me, it was always about the end game of what am I doing now to help prepare me to be a better person later. It's not about what am I doing now and then what am I doing now. That's very circular thinking. It's what am I doing now to be better later. I
Mhm.
hope that makes sense.
Yeah, there was a quote I heard. It's just goes something along the lines of "Do things now that your future self wishes you would have done."
You could not have said that with greater wisdom. That is a beautiful statement. I totally agree with it. I totally agree with it.
Yeah.
I have one final question for you too, is
Mhm.
what type of community involvement and activities have you done to really um, explore situations outside of medicine? For example, have you volunteered at a homeless shelter? Have you done anything with Meals on Wheels, with the Angel Food Delivery Service? Have you did any volunteering at a community of senior citizens? Have you volunteered at a blood bank or a blood drive? Have you worked with, like I did, I worked with Special Olympics for many, many years. Um, I want to hear about, have you worked with veterans, for example? I want to hear about that. What have you done for community outreach?
Very good question. I plan to do more, but
Uh-huh.
currently um, I volunteered at I don't know exactly what you'd call it, but we would give meals to homeless people in the
Yes.
Encino area.
Yes. Yes.
Um, and it's like right by the church, and it's like a religious organization. It's really a great thing. So there's more to come. But I have served meals to the homeless, and that was a really
Mhm.
interesting experience because even within like medicine is service,
Yes,
and
it is.
that's kind of like what other people would think is like the service industry. So I don't
Exactly.
know. It was a good time.
So I want you to really think about that. I was really considering like every, quarter, every maybe at least biannual, at least twice a year, minimal, really doing something outside your comfort zone to really show that you're invested in medicine, because that's going to come up on your essays. They're going to ask you, what have you done? And they're going to ask you why you've done it. And they don't want to see that, the year before you apply to medical school, that you gave away turkeys on Thanksgiving Day to at the Mission downtown. That's not enough. I do that every Thanksgiving so far. Over the past, what, 9 years I've done it, which is great. Well, that's not true, because I didn't do it. That's not true. I didn't do it for 2 years because of COVID, but I did it years before that. But you do want to consider having things on your CV, your curriculum vitae, your resume, that will show that you're not about just the talk of service, but you're about the action of service, because those are very different things.
Yeah, and even so, like in high school, I volunteered at Northridge Hospital on a nursing ward,
Great.
and that I was purely there to serve the patients. I had zero other function. I was answering the call light, and I was getting the nurse to go to the room where the patient was in need, or the
Yes.
social.
Yes.
Um, and I would say that doing like at the hospital and in the serving meals was like hugely important to just understanding how helping people really works when you have no other like at my job. I help people as a scribe, but I'm I mean a part of it is I'm getting paid, even though like I'm not doing it for the money. I'm
Exactly.
still getting paid. It's just like it's a little bit of a I guess a conflict of interest, if you want to put it like that.
But it's still service. It's still service, but it is different. You do want to think about doing those things whereby the compensation may simply be a thank you, I mean, not even be a thank you. The compensation is that you're there, and it helps provide and give you emotional growth, spiritual growth, and to grow your compassion and empathy to be of service to other people. So sometimes the reward is not monetary or physical. Sometimes the reward is simply a a knowingness that what you're doing is the right thing. The one thing I'll share with you too before we close out is that um, when you're in medicine, the one thing I want you to really, really, really remember is that you want to always do the right thing, even when no one is looking. You want to do the right thing because later you still have to look at yourself. So, and there'll be times when people will tempt you to do things that are not ethical, that are not correct, but they want to do them because there's money involved or there's status involved and there's power involved. God has all the status. God has all the power. God has all the money. So as long as you're doing the right thing, all those things will be provided. But again, Alon, do the right thing even when no one is looking. And then when you're speaking to people, think about those three things I'll share that my dad said to me, and that one of the guys that go to the church where I go to, he said it also is that when you speak, is it true? Does it have to be said? And is it uplifting? His name is Dr. Michael Beckwith. He's a good friend, a good person, and a man of great depth and spiritual knowledge. So, um, I think you're going to do great. I can't wait to interview you again 5 or 6 years from now on your podcast. And I'm
Yeah.
going to say, remember I told you to think of these things? You're going to say, Dr. Levi, I haven't thought about that, man. I've been working so hard. You're going to be like, I barely remember you, Dr. Levi. I'm working, man. And I'm going to say, I know, I did it too. Your dad did it. We know. It's not a joke, but you know, you gotta do what you feel is gonna be best for your life, and I think it'll be great. And I
Mhm.
can't wait to hear where you go to school, where you travel to, and it'll be wonderful for you. Just remember, do the work. If you don't do the work, it won't get done. Don't
Absolutely.
talk about the work, do the work.
Absolutely.
Right.
That's hugely important because if you walk the walk, but you can't talk the talk. I mean, actions speak louder than words. Basically, what I was trying to say. If you give
Absolutely.
the best care, if you do the best things, but if you're not able to articulate it, you have a thing to show people.
You're absolutely right. I think you're gonna do great. I'm really excited for you. I'm excited that you will, you know, pick up the torch of medicine and go out and help make the world a better place. The world needs you. I can tell you that. The world really needs you. And I think just keep that at the forefront. Do everything with love and compassion and empathy and treat everybody the way you want to be treated, even when they treat you nasty. Don't go low. You
Mm,
just stay there, treating them with love and compassion. When they're screaming, you speak loud. Excuse me, you speak lower. When they're shouting, you whisper. Just always remember you fight fire lovingly with water, not fire to fire. That's a losing battle for all parties involved.
mm.
Now, you have any final questions for me? Anything that you're thinking?
Um, what is yeah?
Yeah.
If you had to give s- advice to the aspiring orthopedic surgeon, the aspiring orthopedic hand surgeon, or
Mhm.
the aspiring hand surgeon, just what would you tell them right now?
The number one thing I would tell them is if you love it, come on board and do it. And if you're thinking about it, come on board and do it for a while because you may fall in love with it later. And I would also remind them to understand that medicine is an art, it's a science, and it's a business. And you want to work on all three fronts to be the best in each of those disciplines. It's not just the fun of operating, the beauty of getting someone healthy, but it's also having a sustainable business that can be grown and that will be stable so that you don't have to think about all the other minutia, all the other michigas that can come into place if you don't have a stable business. So I would tell them, make sure that you get some form of business training. And many medical schools don't offer that, but that's never an excuse now. You can go to YouTube, you can go online, you can inform yourself. And you could even think about doing that line where you take a business class, you know, even before you get to medical school, once every 3 months, just the basics of medicine, so that you can have an understanding of what you're getting into, because medicine is serious, medicine is wonderful, but you need to know how to navigate this really serpiginous route. It's not easy going, but it's good going. But you have to know how to get through those obstacles. And if you don't get through them, then how do you go over them or under them or around them? But always remember that every obstacle can be conquered. You just have to have the fortitude, the strength, and the faith to do it, and to never take no for an answer, and always work hard. When other people are out playing and partying, mm-mm. Got to separate yourself from the crowd.
Mm.
You got to study and do the work, because the dreams are bigger than the party of today. You want to party later, um, when you have a lot to show for your accomplishments and achievements. I'm sure you're
That's
going to do great. I'm really proud of you. Keep up the work. If I can
Thank you.
help in any way, you can always reach out to me, and I can, you know, be hopefully a sounding board of truth and honesty and authentic service. I know you have your father, of course. He's a really good person and a really smart person. So you have him, but you got me as backup.
All right. Thank you so much, Dr. Harrison. I
Uh,
really
it, was, it was a pleasure. God bless you, Alon. And one thing before you go, do you know what your name means, Alon? Do you know what it means?
in Hebrew it means like a strong oak. Um,
Exactly right. Strong oak tree. I wanted to tell you that. One of my really good friends, his son is named Milan. And the first thing I always ask people when I get to know them is, do you know the meaning of your name? And you'd be surprised how many people they say, no, I don't know, it's just my name.
mm,
Well, no, your name has meaning. I always looked up, Danny Levi Harrison. I want to know, what does my name mean? So just remember that. Be as strong as an oak and as flexible as a palm tree, and you're gonna make it.
that's true.
All right.
Oh, thank you so much.
All
I
right.
feel better now.
You're gonna do great, man. God bless you. Call if
Thank
you
you.
need me. Thanks a
All
lot.
right.
All
Thank
right.
you. Bye-bye.
Bye bye.
Thank you so much for listening, and I hope you enjoyed. If you don't mind, please leave a like and subscribe. And with that being said, see you in the next one.